As a sleep provider, I see a lot of sleep disorders, and one of the most common and something that I have personally struggled with in the past is restless leg syndrome. Most of my patients, when they come in, don't know they have restless leg syndrome. They just know that they have the constant and unpleasant urge to move their legs at rest. And now it's disrupting their sleep, which is why I'm seeing them. In today's video, I'm going to be explaining restless leg syndrome. What does restless leg syndrome feel like so you might know if you have this condition? If you're new to my channel, please subscribe for future evidence-based sleep tips. Link to studies or anything I discuss or recommend will be linked in the description below. Stick around for the whole video because at the end, I'm going to be sharing with you the most common and reversible nutrient deficiency that is linked to restless leg syndrome. But before we dive in, just a reminder to always talk to your own provider if you're experiencing health changes. If you have ever experienced the irresistible urge to move the legs, especially at rest and in the evenings, then you may be dealing with RLS or restless leg syndrome. The main symptom is nearly the irresistible urge to move the legs. But there are a lot of other symptoms that don't get discussed and don't get talked about, and so patients or people don't know they have RLS. This is because it can be really hard to characterize, and there are unfortunately no blood tests, no imaging studies, nothing to diagnose this besides symptoms. So in clinic, we use the acronym URGE, which stands for urge to move, rest induced, gets better with activity, and evening and night worsening of symptoms. This kind of helps clarify, is this RLS or is this something else? Now, restless leg syndrome typically occurs while sitting down or lying down. It generally worsens with age and can significantly disrupt sleep, which is when I will see patients in clinic because they can't sleep or they're not sleeping well. The sensation can be really difficult for people to identify and characterize. And there's a lot of different adjectives that I hear in clinic besides just urge to move. These other common terms that are used to describe RLS include things like need to move, restless, cramping, a creeping sensation or a pulling sensation, sometimes an electric or a tension in the legs, even discomfort, soreness, and sometimes even itching. Now, typically, the sensations are usually felt deep within the legs and often between the knee and ankle. They can occur in other places, but more often than not, it's in the legs. For people who are dealing with this condition, or if you're dealing with this condition, go back to urge. Do you have the urge to move? Is it rest induced? Does it get better with activity? And do evenings or nighttime tend to make it worse? With RLS, it's common for symptoms to get better and worse. Sometimes symptoms will disappear for periods of time just to come back later, which can be really frustrating for a lot of people. The sensation of RLS is unpleasant, but it's not necessarily painful. And it doesn't usually have symptoms like burning, pins or needles, or lack of sensation. That type of sensation is usually experienced in people who are dealing with a type of neuropathy or nerve entrapment or a nerve syndrome. These types of conditions can coexist, but usually they're different. Most patients with RLS will report that walking or movement or any sort of pressure to the area does provide some temporary symptomatic improvement. So some of the strategies that I employ are massage, stretching, hot and cold packs, a warm bath, and as a general rule, most external stimuli will reduce the symptoms. Getting up, getting moving, because again, RLS tends to occur at rest. Now, common consequences of long-term untreated RLS include things like insomnia, because you can't go to sleep, waking up throughout the night, depression and anxiety because you're sleep deprived, and other things that make this worse is that over time, untreated RLS can worsen with age. It tends to have a positive family history, so it runs in families. And your bed partner or the person sleeping next to you might say that now you're starting to get a periodic limb movement disorder, which again is another condition, but the two are linked. Now, there are lots of causes of RLS. And in future videos, I want to break down those causes and break down further treatment options. However, as promised, I want to share the one most common reversible cause of RLS, and that is iron deficiency. So if you're newly experiencing RLS symptoms, Get a simple blood test by your doctor, because if you're iron deficient and you replete this, we might be looking at symptom improvement in a few weeks. If you found this video informative, make sure to give it a thumbs up, comment for future video ideas, and if you're looking for other RLS related videos, please subscribe to Sleep Coach Adam. Sweet dreams, everybody.